Rhinitis in children. This is part 2 video where we are going to deal mainly about treatment. Now, first let us see how we deal it, how we take care at home. Lifestyle modification, what all things to be done at home, what all things to be avoided at home. Most important being, if you have any pet animals at home, please try to avoid. If you are not able to avoid, please keep the pet animals outside and have a special caretaker for that, and take care of the animals well and try to take the animals to the veterinary doctor to keep it clean, and he will give you the proper advice. That is one. Second is, what all things to be done at home. The walls, the floor and everything should be blank as far as possible. What I mean to say is, please do not have any hangers. Do not hang anything on the wall, because it will be easy to clean, and you have to do the cleaning of the walls and the floor, everything, with a wet cloth which is dipped in warm water, say about 50 to 60 degrees temperature. The flooring, try to avoid a carpet. If it is cement flooring or tiles or even wooden flooring, that's okay. I know wooden flooring is costly, but if you can prefer, that is better. Now, coming to the furniture, try to avoid cloth covered furnitures, and leather furnitures are better for you. Now, the mattress and the pillow, all these should be covered with plastic cover, so that it's easy for you to clean with a wet cloth. And the mattress has to be exposed, it has to be put in sunlight for at least 3 hours monthly once. And try to change all your cloth curtains to plastic curtains, so that every 2 weeks you are able to just dip in warm water and you can dry it off fast and you can reuse it. So it will clean up, you can clean it up very fast. When you have small objects like toys and books at home, please do not keep it outside, keep it inside the drawer. And advise a child to wear a mask always. If you have an air conditioner at home, try to clean the filter often, every 2 weeks at least. Usually what happens is, we do not clean the filter, or we do not care about the air conditioner till the cooling system comes down. Say maybe once in a year, when the cooling system comes down, we concentrate on that. On any one holiday, we try to clean it up. But when you have a child at home with moderate to severe allergic rhinitis, please do try to clean the air conditioner filter weekly, every 2 weeks, fortnightly. And same thing, it's applicable for the air conditioner in the car too. Now, all these I have already mentioned. And if you have any unused or minimally used utensils in the kitchen or wheresoever, please do not keep it outside. Try to pack it up and keep it in the storeroom. And when you do the cleaning, try to do the cleaning with a child who has got severe allergy, when the child is not there at home. Now, things to be done outside. It's always better that the child has got he does some mild sort of exercise always. And about the car, I have already mentioned, you have to clean the air conditioner filter of the car, and the cover upholstery, it's better that you have a leather upholstery instead of a cloth one. And please do not try to hang any stuffed toys in front of the car also, near the windscreen. Try to avoid all this. Now, coming to the treatment. The main treatment being steroid nasal spray and nasal wash. I am concentrating in this video, I am concentrating or talking only mainly about moderate to severe allergy. Mild allergy does not require any special care. So, coming back to the treatment, the steroid spray, it has to be used once daily, and it is usually avoided below the age of 2 years. So, you have to use 1 puff this side, 1 puff the right nostril, on each nostril 1 puff, and once daily only. And this dosage can be twice daily above the age of, say above the age of 8 to 12. But generally in children, it is preferred once daily only. So, sorry. How to use the nasal spray? what is the technique of using the nasal spray? If you want to know, please enter Dr. Zakir Hussain ENT nasal spray in YouTube. You will get it in detail. Now, coming to nasal wash. We have this isotonic nasal wash, the salt-free spray, which contains only saline, that is salt water. And this is very helpful. This has to be used at least 3 times daily. So what it does is it gives a nice washing of all the nasal covering, nasal cavity, 1. Any allergen which gets deposited will be washed out, 2, so that the allergic reaction doesn't start. And the mucosa, thin mucosa or thick mucosa, whatever is there in the nose, which leads to blocking, everything will be removed, 3. The normal action of the mucosa will be enhanced, 4. Normal cilia, which is seen in the mucal cavity, will be removed, 5. If there is any pus or sinusitis, it will help to clear all the mucopus too, 6. It has got so many other actions, but I am just mentioning a few. So this can be used even if the child is less than 2 years old. This is a single best treatment, if you ask me. Now, in spite of using nasal spray and nasal wash, in between the child may get one allergic episode or severe episode. In that case, for that short duration, we can use a leukotriene inhibitor along with antihistamines too. It's a good idea that we deworm the child every 6 months once, which can be done with albendazole syrup or with mebendazole syrup. Albendazole has to be used once only, that too in empty stomach. If you are preferring mebendazole, it has to be twice daily for 3 days, continuous 3 days. Now, this is a medical treatment. Now, to prevent further episodes and to prevent the decrease of episodes, we can do immunotherapy, but this is usually preferred so in adults, not in children, especially below the age of 5 years, it's contraindicated. We don't prefer at all. Below the age of 5 and those with dermographism and pregnant ladies, we don't prefer to do it. Usually, practically, it is seen that above the age of 12 also it can be done. There are so many ways of doing it, which I have shown. There is no single surgical technique described to remove allergic rhinitis. It's a hereditary condition and the child gets it from the parents. You cannot remove the allergic rhinitis condition from him. We can only manage it with medicine. The day you stop the medicine, the day you stop the nasal spray, after a few days, about 4 or 5 days, he gets all these complaints once again. So we have to manage it at the lowest dose possible here if he has got moderate to severe allergic rhinitis. But one thing I would like to tell you, suppose the child has got snoring, that is sound during sleep, and he opens his mouth and sleeps in the night in a particular position, and he has got a disturbed sleep, and he has got apneic episode, that is breath stopping episodes at night. And when you do an X-ray of the nasopharynx, the behind the nose, and if it is seen that there is something called adenoids, then that adenoids has to be removed. Why? Because already the child is suffering from moderate to severe allergic rhinitis. On top of that, if he has got adenoids also, then his all normal activities and sleep will be severely hampered. That's why he has to undergo adenoidectomy or removal of the adenoids, so that we can give him a better quality of life. With the medically we can manage the allergic rhinitis better. That's why. That's the only thing we have to do extra. Now, this is how we manage allergic rhinitis in a child. Thank you so much.